Your body can be having a heart attack without the dramatic chest pain you expect. Millions survive one and never realize it happened. Ignoring these subtle signs can cost you your life. A heart attack is often imagined as sudden, crushing chest pain followed by collapse. In reality, many heart attacks happen quietly, subtly, and without the classic symptoms people are taught to recognize. These are known as silent heart attacks, and they are far more common than most people realize, especially in the United States and the United Kingdom. A silent heart attack occurs when blood flow to the heart muscle is partially or temporarily blocked, causing damage without triggering intense or obvious symptoms. The heart muscle suffers injury, but the warning signals are so mild or unusual that they are ignored, misinterpreted, or attributed to stress, aging, or minor illness. Some people only discover they had a heart attack years later during a routine ECG or imaging test. The danger of a silent heart attack lies in its invisibility. Because the person does not seek immediate medical attention, the damage goes untreated. This increases the risk of future, more severe heart attacks, heart failure, dangerous heart rhythms, and sudden death. In fact, research shows that silent heart attacks carry a risk just as deadly as classic heart attacks. One of the most overlooked warning signs is unexplained fatigue. This is not ordinary tiredness after a long day. It is a deep, persistent exhaustion that appears without reason. People describe it as feeling drained after minimal activity, such as climbing stairs, shopping, or even getting dressed. This fatigue can last days or weeks before the heart event and is often dismissed as stress, poor sleep, or burnout. Another subtle sign is shortness of breath. This can occur without chest pain and may feel like difficulty taking a deep breath or becoming winded during activities that were previously easy. Some people notice breathlessness while lying down or waking up gasping for air at night. Because lungs feel involved, many assume it is asthma, anxiety, or a respiratory infection. Discomfort in areas other than the chest is a major reason silent heart attacks are missed. Pain or pressure may appear in the jaw, neck, upper back, shoulders, or arms, especially the left arm. The sensation can feel like stiffness, aching, or burning rather than sharp pain. Dental pain or tightness in the throat is also commonly reported and frequently misdiagnosed. Indigestion-like symptoms are another dangerous misdirection. Nausea, bloating, heartburn, or stomach discomfort can all be signs of reduced blood flow to the heart. Many people take antacids and wait it out, believing they ate something wrong. This is particularly common after meals or during periods of stress, which further confuses the cause. Cold sweats are another warning sign often overlooked. Sudden sweating without exertion, especially when accompanied by weakness or lightheadedness, can signal a heart problem. The sweat is usually described as clammy rather than hot, and it may occur even in cool environments. Dizziness or feeling faint is another subtle symptom. Reduced blood flow affects the brain, leading to imbalance, confusion, or near-fainting episodes. People may sit down, drink water, and assume dehydration or low blood sugar is to blame, missing the real danger. Sleep disturbances can also be early indicators. Some people experience insomnia, vivid dreams, or frequent waking in the days or weeks before a silent heart attack. Nighttime chest discomfort or breathing difficulty is particularly concerning but often ignored. Silent heart attacks are more common in certain groups. Older adults are at higher risk because nerve sensitivity decreases with age, reducing pain perception. People with diabetes are especially vulnerable because nerve damage can dull pain signals. Women are more likely than men to experience atypical symptoms such as fatigue, nausea, and back pain rather than chest pain, leading to delayed diagnosis. High blood pressure, high cholesterol, smoking, obesity, and a sedentary lifestyle all increase the risk. Chronic stress also plays a significant role by increasing inflammation, blood pressure, and unhealthy coping behaviors. Family history further compounds the danger. After a silent heart attack, the heart muscle becomes weaker. Scar tissue replaces healthy muscle, reducing the heart's ability to pump effectively. Over time, this can lead to heart failure, characterized by swelling in the legs, chronic fatigue, persistent cough, and worsening shortness of breath. Another serious consequence is arrhythmia, or abnormal heart rhythm. Damaged heart tissue disrupts electrical signals, increasing the risk of sudden cardiac arrest. This can occur without warning, even years after the silent heart attack. Diagnosis often happens accidentally. An electrocardiogram may show abnormal Q waves indicating past damage. Imaging tests such as echocardiograms or cardiac MRI can reveal areas of reduced movement or scarring. Blood tests are usually normal long after the event, which is why many silent heart attacks go undetected. Prevention depends heavily on awareness. Recognizing that heart attacks do not always look dramatic is critical. Any unexplained, persistent symptoms affecting breathing, energy levels, or upper body discomfort should prompt medical evaluation, especially in high-risk individuals. Lifestyle changes significantly reduce risk. Regular physical activity improves circulation and heart strength. A heart-healthy diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats lowers cholesterol and inflammation. Reducing salt intake helps control blood pressure. Managing stress is equally important. Chronic stress hormones damage blood vessels and increase clot formation. Techniques such as mindfulness, adequate sleep, social connection, and regular exercise are protective for the heart. Routine health screenings save lives. Monitoring blood pressure, cholesterol, blood sugar, and weight allows early intervention. Medications such as statins, blood pressure drugs, and antiplatelet therapy are highly effective when prescribed appropriately. If a silent heart attack is suspected or confirmed, treatment focuses on preventing future events. This may include medications, cardiac rehabilitation, and in some cases, procedures to restore blood flow. The earlier intervention begins, the better the outcome. The most dangerous belief is thinking, "It can't happen to me." Silent heart attacks often affect people who feel generally healthy. Listening to your body and taking subtle changes seriously is not overreacting, it is survival. Heart disease remains the leading cause of death in both the United States and the United Kingdom. Many of these deaths are preventable with awareness, timely action, and lifestyle adjustments. The heart rarely fails without warning. The warnings are simply quieter than we expect. Learning these signs does not create fear, it creates power. Power to act early, seek help, and protect your future. A silent heart attack does not have to be fatal, but ignoring the signs can be. If this information could help save even one life, share it, subscribe, and stay informed. Your heart depends on it.